Hello and thanks for watching. We're going to talk about sterile solutions and catheter maintenance in rodents. Let's start by talking about flush and lock solutions. First thing that is very critical is to always use sterile USP pharmaceutical grade flush and lock solutions. So what is the difference between the two? A flush solution is a solution to clear catheters during the surgery, for catheter maintenance, or after compound infusion. A lock solution is a solution to fill the catheter when not in use, primarily to prevent clotting. So when you're done with the animals, you put them back on the shelves. Lock solution is what you will put in the catheter. Let's go over the different types of flush solutions. There are only two types of flush solutions. So you have saline and you have heparinized saline, usually at a very low concentration of 10 to 20 USP units per ml. And of course, the heparin will help in preventing the clot formation. Now let's talk about the different types of lock solutions. There are different options when it comes to lock solutions, and just to name a few, there are heparin glycerol, heparin dextrose, heparinized saline and saline, which were flush solutions that can also be used as lock, and toluidine citrate. Heparin glycerol was and still is a commonly used lock solution. It usually comes with a high heparin concentration of 500 USP units per ml, which has the potential of introducing high concentration of heparin into the bloodstream. Its high viscosity prevents the blood from diffusing into the catheter tip and forming a blood clot. Historically, it was used and needed with an open system because the catheter is exteriorized, so it minimizes the evaporation of the solution through the catheter walls. Another commonly used solution is the heparin dextrose, also usually come with a high heparin concentration of 500 USP units per ml, and also historically used with an open system and the exteriorized catheter to minimize the bacterial infections. As you know, working with an open system, you have a lot more risk of infections than if you were to work with a closed system. This solution is very sticky due to the dextrose, and the same thing, since this is a high concentration heparin, you have a risk of introducing that into the bloodstream. Now we have the heparinized saline. This flush solution can be used as a lock solution in a closed system with a subcutaneous catheter. Its use is becoming more frequent, as it has been shown that it can be used successfully in that setup. The low heparin concentration of 10 to 20 USP units per ml makes it very safe even when introduced into the bloodstream. Saline can also be used as a lock solution, especially when the system is frequently accessed. Toluidine citrate is a good alternative when heparin cannot be used. It has antimicrobial action and is often used in larger animals. Let's go over catheter maintenance. Some important points for catheter maintenance. Catheter maintenance may differ depending on the lock solution used. For example, if a high heparin concentration solution is used, the first thing to do is to try to remove that solution, and you will need to change the syringe before infusing or flushing. If heparinized saline is used, it doesn't matter if it's removed or not, and the same syringe can be kept for flushing. The recommended maintenance frequency for a closed system is once a week, which is not as often as with an open system. Avoid air bubbles to prevent their entry into the bloodstream. Use positive pressure technique to prevent blood from entering into the catheter tip. Please refer to our website if you need more information on this technique. And again, use caution if using lock solution with high concentration of heparin. A few things to remember. The first one I already mentioned, but I will repeat it again. It's always try to withdraw the lock solution with high concentration of heparin before infusing. You should know always your system's dead volume, right? You need to know what the dead volume of your catheter is, but also the VEB, so that you can infuse what's needed and not too much. You want to disinfect the VEB port and the septum with sterile swab and alcohol prior to use. And don't forget to flush solution through the pin port injectors prior to connecting it to the VEB's port. You don't want to introduce air bubbles. The supplies needed for flushing. You will need sterile syringes and pit-borne injectors, sterile USP pharmaceutical grade flush and lock solutions, use sterile swabs and 70% ethanol to disinfect the vascular access buttons, port, and septum, and a handling tool if you work with mice. You can also get sterile maintenance kit pre-made for you with the solutions of your choice in the syringes. Let's go over the terms for patency. What does it mean if a catheter is fully patent? That means that you can withdraw blood immediately when you first try, and of course you can infuse. Patent on flush means that you try to withdraw blood, it doesn't work, so you infuse your flush solution, and then you try to withdraw, and it works. So it's patent on flush. Partially patent is that you can infuse only, and non-patent is that it doesn't work at all. No blood withdrawal or infusion. I want to talk a little bit about laminar flow since it can affect the amount of lux solution that is needed to completely fill the dead volume of your catheter. So what is the laminar flow? Laminar flow is a simple fact that the fluid at the center of the tube move actually faster than fluid on the edge, and it's worse with viscous solution. That test here with a dead volume of 100 microliters was actually done with heparin glycerol, which is more viscous. So the volume infused when the lock solution reached the catheter tip with a 100 microliter dead volume was 80 microliters. So already reaches the tip of your catheter with only 80 microliters infused. The volume that's infused into the animal when 100 microliters infused is actually 4 microliters. So you have a little bit of your lock solution that made it into the bloodstream. But what's very interesting is that the volume that's needed to completely fill the catheter dead's volume is 170 microliters. So that means, of course, you're putting 70 microliters of your lock solution into the bloodstream. That is always something to consider when choosing your lock solution. In conclusion, you should always use the lock solution that best suits your needs. Don't forget to always use sterile USP pharmaceutical grade solutions, and that low heparin concentration solution may be a good alternative to high heparin concentration solution in closed system. Always consider also the laminar flow when you calculate the volume of lock solution needed. That is it for this presentation. Thanks for watching and have a beautiful day.